Hello and welcome to the EMJ Gold podcast, brought to you by EMJ, your #1 open access destination for HCPs and pharma globally. Hi Jade.
Hiya.
Welcome to the finale.
Thank you. Can't believe we're here already.
I know, it has really gone by so quickly and it is almost time for us to head off on our winter break. But before we do, we've got a really exciting guest to share with our audience. So recently today, I had a conversation with Dr Cecilia Caetano, who is the Vice President and Head of Global Medical Affairs for Women's Health at Bayer.
And she is an absolute expert in women's health, I have to say. It's a super interesting conversation. I had the privilege of sitting in on that. And it's all around how we can normalise the menopause discussion and ensure that women aren't suffering in silence as they go through this change in their lives. I know it's a topic that you're personally very interested in, Isabel.
Yeah, I always love discussing women's health in all its facets. This is one that we haven't actually covered on the podcast before, so it was really exciting to do that. But before we head into the discussion, so we tell our listeners a little bit about today's guest. So Cecilia actually started out her career as a gynaecologist and obstetrician in Portugal before she joined Bayer's medical team in 2015. And she's been there for nearly 10 years now, so a really impressive stint.
And she's had experience across a broad range of stages as well while she's been at Bayer, including things like product launch, training and education, patient engagement, and so much more. I know she speaks a bit about patient engagement during the discussion as well. She is, as you say, particularly active in the area of menopause management, and she's determined to break taboos and foster that open conversation around menopause that she thinks the world needs. But I do think that's enough from us for now. Shall we listen into the conversation?
Let's do it. Cecilia, hello. Welcome to the EMJ Gold podcast. How are you doing?
I'm very good. Thank you, Isabel. Glad to be here.
Well, we're very glad to have you. And we're actually going to be talking about a topic today that I am personally very passionate about, which is women's health, and more specifically, the menopause, which I know is an area you're really passionate about, and actually an area that I think deserves more airtime than it currently gets. So very much looking forward to getting into the topic today. But before we do, we always like to get to know our guests a little bit more. So Cecilia, I know you began your career as a gynecologist before you moved into the pharmaceutical industry. So I guess to kick off, why did you decide to specialise in this area of medicine, and how did that kind of lead you into the role you're in the pharmaceutical industry now?
Yes, well, Isabel, I come from a family of very strong women. So topics related to women empowerment and the woman's role in society were part of my environment growing up, from my grandmothers, great-grandmothers, my mother as well. And so I always had a very strong passion for biology, for medicine, for innovation. And since so many times women's health issues are barriers for women in society, it became clear to me that my role in this set would be to really advance innovation for women and contribute to women empowerment from the healthcare perspective. And so when I was at med school and looking into specialties to further specialize my studies, it was very clear that I had to go to Gynaecology and Obstetrics, and that's how I became a gynecologist and obstetrician back in Portugal, where I'm from. And so indeed, to me, that was something that was very clear since my teenage years even. And then when I was working in the hospital, I had the opportunity to experience firsthand with my patients how pharma can really bring innovation to medical practice and change procedures, change the way some diseases are diagnosed and treated, and the outcomes for patients, for women. And so I was really motivated to join pharma to be part of that innovation. And it's such a wonderful feeling being able to really change the life of many women at a time instead of one by one, as we do in clinical practice. That's something that always brought me a lot of passion and energy as well. I think in a way, being in pharma, we can be bigger than ourselves and really contribute to the big picture and to really advance gynecology in this case. And that was something that really energized me and what brought me then to Bayer. So I joined Bayer in 2015. First in the contraception team, then moved into different roles, and now very much focused on menopause management, a topic also very, very close to my heart. And within my roles at Bayer, I was always very, very strongly focused on medical education. And we will talk about this, I'm sure, because it's so important in the topic of menopause as well. But it's so important to be able to provide patients with accurate and understandable information so that discussions can happen and that women's health topics are not barriers to women in society, in their lives. So these are really topics that are very, very dear to my heart.
Well, your passion is so clear, not just through kind of your career path, but also the way you talk about it. And you've really worked across the whole spectrum, as you noted there. But yeah, as we mentioned, we are going to focus on menopause today. So to set the scene on the conversation, you know, perhaps for any younger women listening, men of all ages, how does the menopause affect women? How does it affect their daily lives, both professionally and personally? What changes during this period of a woman's life?
Well, menopause is not a disease, right? It's actually part of women's life. So it will come sooner or later to about 50% of the world's population. And we know that by the end of 2030, the population in the world experiencing menopause will rise to 1.2 billion, with around about 47 million of new entrants every year. So this is really a topic that is very relevant for women, but also for countries, for healthcare systems, for society around the world. Menopause is in itself a normal process of women's lives, which is related to loss of ovarian function due to aging. And this will make estrogen levels to decline, to decrease. And this can also happen not only related to the natural aging process, but also to medical treatment, being, for example, surgery. Some women need to have their ovaries removed and they will enter then into menopause, but also to medical treatment. And there are many women who are, for example, breast cancer survivors that struggle with menopausal symptoms as side effects of their treatment. So these symptoms can really impact many women across different ages and across different stages in their lives. And impact is really variable as well, because although the process behind is exactly the same for all women, the way that symptoms are perceived and the severity of symptoms is really different from women to women. So menopause is a very individual experience, which makes it even more difficult, because if what I experience might not be what you experience, how can we find a basis for understanding and for sharing experiences that really brings the individual experience to the center, right? And so some women have very limited symptoms or very mild symptoms, but others have very severe symptoms that can impact their lives to a very big extent. And sometimes by comparing experience with each other, some women might feel, oh, because my friend says that menopause really didn't impact her, I should not complain about my symptoms because that's normal. And that's really what we need to try to stand against today. We know that virtually all systems in the body can be affected by menopause. And so symptoms, we now know also that menopausal symptoms can have an impact on the life in the long term, in health in the long term as well. And that they are independent risk factors for cardiovascular disease later in life. So menopause management is really a very important topic, and being able to identify the symptoms and have these discussions with healthcare providers is crucial.
Well, yeah, you really touched on what I want to ask you about next there. I think the broad spectrum of symptoms, and obviously some symptoms being a lot more well publicized or understood than others, obviously leads to difficulties with diagnosis. And I want to ask now, how can the industry play a role here?
It takes two to have that discussion. So in one hand, we need to make sure that healthcare providers are well equipped and trained to identify symptoms and to counsel their patients. But on the other hand, we also need to provide women with the knowledge and the awareness they need to really bring these topics to their healthcare providers' attention. And that's something that is not really happening today, still to a great extent, because currently when it comes to menopause, the focus is pretty much on coping, and that creates a culture of silence that really hinders then optimal treatment and care. And I saw that in my patients. They would not start the conversation because menopause is such a taboo topic that they feel sometimes is not worth to bother the HCP asking about those normal things in women's life. That's also something that is not only seen in menopause. I saw that with many other topics in women's health, with period pain, with heavy periods, with sexual pain, postpartum depression. It's such a rule for women to have to suffer, to cope, to take all these elements that are related to women's health as part of being a woman. And it's almost even perceived by society as a sign of strength, that if a woman suffers and doesn't complain, then she's strong and she's more of a woman than others.
Yeah, badge of honor.
Absolutely. And that's exactly what I always stood against as a healthcare provider, as a obstetrician gynecologist, and now working in pharma, really making sure that women have access to information, that they really can understand their body, what is normal and what is not. Because indeed, menopause is normal, but suffering is not. And so the time that menopausal symptoms start impacting quality of life is really the time to act and the time to seek help, because there are options, and having that discussion with healthcare providers is key. But on the other hand, healthcare providers also need to make sure that they have at their disposal tools and knowledge to be able to identify symptoms. And many times, because of this perceived menopause is just normal part of women's lives, there is also a lack of focus from the healthcare provider or the gynecologist or the general practitioner on really trying to identify and explore the impact of menopausal symptoms, which is also not seen. So there is still a lot of silence around what menopausal symptoms really entail for women in society, in their lives, for their families, at work, for example. And so there is that perception that menopause is not a problem, and if you don't talk about it, then it's even less of a problem, which is really not true. So I think part of my work and our work at Bayer has really been to develop educational content and educational activities together with medical societies, with thought leaders, but also with women, to really make sure that we bring all these symptoms and impact, and we support women to be better prepared for those conversations, but also support HCPs to be able to identify symptoms in the short time they have with their patients, which is also a challenge. So I think that that's a very important part of the work that we do.
Yeah, really, really interesting, Cecilia. I love the way you kind of phrased that and looked at it as that two-pronged challenge that needs to be solved. You're so right. It is both parties need to be empowered to make those calls and those decisions.
So I think for pharma companies, as drivers of innovation, as drivers of science, we really have the responsibility to provide clear and accurate information that is adapted to different audiences, to make sure that healthcare providers and women can make informed decisions. And the information needs to be tailored to these different audiences, so it's understood. So at Bayer, as I was mentioning before, we really take this responsibility very seriously. And we have a big focus on medical education. So we collaborate regularly with medical societies, with thought leaders, but also with advocacy groups and women themselves that are part of our boards, to co-create materials, to listen to their needs, so that we make sure that we create materials that are meaningful and tailored to their needs. And I think that's something that we incorporate in everything we do within women's health.
Yeah, it's a really interesting topic, and it will be fascinating to see how attitudes evolve over the coming years. I think the conversation slightly is shifting, but yeah, it will be interesting to see what happens there for sure. Something I want to touch on is separate to misinformation, but more around access. So we hear a lot about period poverty in low to middle income countries. I feel like we don't hear as much about the menopause and the effect that might have on you if you don't have good access to healthcare resources. So I suppose what role can pharma play in kind of getting better menopause care to women that really need it and can't access it at the moment? And if there's any specific initiatives that Bayer's running, I'd love to sort of hear about those as well.
And absolutely. So I think there are three main aspects to consider when looking into access and what we can do. The first one, as we already mentioned, the culture of silence. That's something that we really need to fight against, and to really break that silence with science and bringing science in an understandable way to women, to healthcare providers, to society as a whole. And this is actually seen around the globe. It's not only typical from the Western societies, that there is this culture of silence. Looking, for example, into Asia, in Japan, it is impolite for a gynecologist to ask a woman, a patient, about menopausal symptoms. So they just don't. And by not asking, again, it looks like there is no problem, but it just makes the problem bigger and bigger and prevents women to have access to care. This is seen in many, many different countries, and also responsible by interesting changes in numbers of prevalence of different symptoms. Culture plays a very important role. And we see in society many times menopause being related to being old, to being useless, to being less worthy than younger women, which is definitely a topic that we need to address and really make sure that all this negative connotation surrounding menopause is destroyed, because this is a very important barrier in many parts of the world. And there is also the preparation for menopause. We know, for example, for teenage girls at school, at home, they get a lot of preparation, the talk before their first period. But nobody prepares women for their last. And discussions around menopause are very, very scarce, even among friend groups. It's just not nice to talk about it. It's a bit like menstrual periods and heavy periods. It's just something you don't want to talk about so much. And so it perpetuates that silence, and that will definitely have a big impact in access to care, because if you don't speak, if you just choose to cope, then there will be no drive to really solve the problem or even identify the problem. So that's one very important pillar in this topic. The second one is on the HCP side. And in this, we see that within the last years, there has been a very limited focus on the menopause field as such in gynecology. And in some countries, for example, the United States, the menopause was completely removed from residency training. So newly formed obstetricians, gynecologists now leaving the hospitals, they have no training in menopause. And that really perpetuates difficulties in counseling, knowledge gaps in identifying symptoms, in being able to even refer women to other providers. And so interesting results. For example, there was a survey done in 2018 where 80% of the OBGYNs that fulfilled the survey mentioned that they were barely comfortable discussing menopause. And of course, this adds to the culture of silence, because if we bring together a woman that doesn't want to speak and a healthcare provider who doesn't know how to speak, then there is a perfect recipe for perpetuating that silence. And then I think the third bucket is really around innovation. Over the last years, there was very limited innovation in the field of menopause management. And there is a need to really broaden treatment choices, to really advance that innovation in the menopause field, so that we make sure that there is the option to individualize care to different needs of women. And so this is also a pillar which is very relevant. And of course, on the pharma industry side, it's definitely a driver for us to further build on the innovation that we want to drive in women's health and bring additional treatments and options for women and their healthcare providers. So at Bayer, we are very active in fostering that innovation from a development perspective, but also when it comes to activities that we do it within medical societies and educational activities as well. So this is something that keeps us busy as we really try to break the silence and provide more options to women.
Thank you so much, Cecilia. You've got so much knowledge on this topic, and some of the examples you raised there were really surprising, particularly around Japan and also the United States. You know, you wouldn't think those would be some key places where there would be issues. But yeah, really fascinating. And I hope this podcast does raise some awareness on this. To conclude, though, I would love to kind of get a final thought, really. We've spoken a lot about menopause and the various issues, also sort of quite a few points of hope, I would say, for how things are potentially changing. So yeah, to finish up, how can we shift the conversation around menopause from being a women's issue, something we've got to deal with and sort out, to a broader societal, organizational priority? I think priority is a key word. What do you want to see change in your lifetime?
Oh, that's a very good question, and that's what takes me to work
Tough one
every
to
day
end.
with a lot of energy. Absolutely, but it truly takes a village, doesn't it? I think it is an issue that needs to be addressed by so many different players, and pharmaceutical industry is one of the pillars. But we have so many other players that we need to activate and bring across with us to really join the movement and change the narrative around menopause. We know that indeed it is not only a women's health issue. It is a topic that impacts society as a whole. Menopause at work, the impact that symptoms might have in long-term life outcomes, the impact it has for women in terms of mental health as well. Cognition, are a very important topic. And considering the relevant role of women in their families, in their communities, in the workplace, this is really something that should be a priority in the agendas, not only for in the medical side, but also in terms of policy and political agendas as well. We know that now with increasing life expectancy, women live up to 1/3 of their lives during menopause, and it's a time where they are very active. With the delaying of the age of the first pregnancy, we now see many women transitioning from postpartum to premenopause or to perimenopause. And so this is really changing also the image that we have from women that are in menopause, from to women that are actually very active as mothers of many times young children, carers of family members, but also very skilled workers in the workplace that have a very important contribution to their teams. And so I truly believe the time is now. We see already a lot of movement in the UK, and that's where we get so much inspiration of the amazing activities that are happening in the UK. Today, menopause is truly a hot topic there. And we see, and I think as we see, and hopefully we will see even more women reaching decision-making positions, not only in healthcare, but also in medical environment, but also in politics, in policymakers, in payers, regulatory agencies. I really believe that they will be able to bring menopause as a topic more in focus in those circles as well. And this is very important to be able to drive change, because it really needs efforts around multiple different areas to drive this change in the way menopause is perceived, the impact is understood, and women have access to treatment and to care. So I think providing education and awareness is definitely crucial, and I think that's a topic that we need to really continue to work on, not only for women, but also for girls, also for men, for managers. I think there is really need to expand education and awareness around society as a whole, so that this topic can be discussed and normalized, but not that. And sometimes it's something that I hear very often. We need to normalize discussion around menopause because menopause is normal, but we should never normalize suffering, because that's definitely not normal. So being able to provide accurate information on when normal is not normal any longer will be really key to advance the way menopause is perceived and managed. And here is where we also want to lead by example at Bayer, and we have our own focus group around menopause at Bayer, really willing to make Bayer even more menopause friendly and to provide our colleagues, employees, but also managers the tools they need to be able to discuss and to provide support to their colleagues and peers. And I think this is really something that needs to come from within. And it needs also to be driven by us, women, as well, integrated in our families, in our society, to really talk about menopause in a very open way. Only like that we can really start changing the scene.
Well, Cecilia, it's been such a pleasure to talk to you. I think, normalize the conversation, not the suffering, is a very key point I'm going to be taking away from this conversation, as well as so much more. So I really want to thank you for joining me. It's been a pleasure to speak to you.
Thank you so much, Isabel. Likewise.
Thank you so much.
I really enjoyed listening into that, Isabel. There is really no denying Cecilia is an expert in her field. It was really wonderful to listen into.
Thank you, Jade.
I'm sure, as always, you've got a favourite moment from the discussion to share with everyone.
Yeah, loads of favourite moments from that. I think you could really hear Cecilia's passion throughout. And I think what we finished off with there was really crucial about how we need to normalise the discussion, but not the suffering around the menopause. I thought that was a really interesting point. There are over 50 symptoms of menopause, something I sort of knew, but not quite to that extent. And, you know, if we don't talk about them, women will think that they're normal and they just have to get on with it. And that is just not the case.
Exactly, yeah. Unless these symptoms are brought to light and they know about them, how can they ever know?
Yeah.
Hugely important. Already in the UK, I'm not sure if you're aware, but wait times for gynaecology appointments have more than doubled in the last 4 years as well, which is quite stark. And
Another sobering statistic.
Yeah, exactly. It only adds to the problem. You know, if the discussions don't start soon, it only equals a longer wait time for women. I also really liked what Cecilia touched on around how industry can help to encourage women and HCPs to really have that productive conversation around the menopause. As she said, what is the point of all the research and advancement that goes into the field with treatment if those two-way discussions aren't actually happening?
Very good point, very good point. I think it's an issue that requires change and input from across the healthcare system, as is the case for many women's healthcare issues. Actually, it's far from a one-stakeholder challenge, but as we said at the end there, hopefully everything is heading in the right direction. And that brings us to the end of the episode, the end of the season. Thank you so much to Cecilia for making such a wonderful finale guest. And thank you to all of you for listening to us for this season.
Well, we won't be away for too long. In 2 upcoming bonus episodes, we're going to be looking back at the year just gone and looking forward at the year to come with the help of some familiar faces from our podcast class of 2024.
Very much looking forward to those. Until then, it's going to be goodbye from us.
See you.